Hi everyone, I'm Dr. Schneider here at Riverview Face and Body Aesthetics, and we have the beautiful Viki with us today.
Hi.
And we want to hear, we're going to be doing a facelift and a neck lift, and she's given us permission to share with, the world and our community her surgery as well as her journey. And so, like some of our other patients, we want to kind of see the process unfold and hear in your own words why you're deciding to do this now and what your goals are.
Great. Hi, everybody. I'm Viki, and I am 59 years old, and I have been on a journey of a couple of years of a lot of self-care, things I've always wanted to do and changes that I'd like to see. So this is just a natural progression to move into specifically working on what you see here on my face and my neck. And I've decided to do this at this time in my life because I don't really think what you see in the mirror is how I actually feel inside. It's shocking sometimes, if I can be totally honest.
Absolutely.
It's shocking sometimes when you see you look tired, or you just like, that is not who I actually am. What happened, And I think that's kind of a normal reaction, but I just decided to start doing something about it and did a lot of research, and here I am. So I'm very excited.
Wonderful. Well, we're very happy to have you here. Just briefly, in the past, we have done Viki's upper eyelids, and she's trusting us with, working on her face and neck today. And so I just want to review with everyone how we're going to do that, and then I'll obviously for you too. And so we're just going to kind of mark out our incisions, and just so you kind of are aware. So we like to kind of bring it to the, where the eyebrow is, the tail across. And so most people end up with one around here. And then you have very nice dense hair in this kind of temporal tuft of hair. We're going to go around that. So I'm just going to do our tentative line here to the front of the ear. Then we have this natural crease right here. We're going to use that. We're going to go behind the tragus always, around the ear like this. And I always tell people, this skin that we go around the ear here, that's going to end up being at a minimum up at the top of the ear canal. So you can see here the top of the ear canal is right here, back here. And then usually we'll pick a line together, but typically it's like this one here. So as we trace this line back, it'll be like that. So, and it's going to go along this dense part of your hairline here. So through all of that, Viki, we're going to be able to lift the mid face, lifting this. Excellent. Lifting the jowl, and then of course lifting the neck. And we always do some liposuction down here, partly to remove fat, but then also partly just to loosen the skin around here so that we can redrape it nicely without a lot of tension. Because we don't want there to be tension. And I always tell people it's not really a horizontal lift like those old facelifts. We really want more of a vertical lift because we age from the top of our head to the tip of our toe. And so that complete sheet of elastin and collagen of the skin goes with gravity. So we want to lift those elements back up to make it look natural, but rejuvenated, so that when you're in this next chapter that you are talking about, it looks natural, and very few people will be able to see that incision unless you look really closely in the first year.
That is so great, and thank you for all the education. And that's what I mean. This is how you're taken care of when you come here. Everybody is so nice, and they're so welcoming, and you just feel very safe. And so thank you for that. I like to be educated along the way. I think everybody does. And so that's a big piece of what I heard when I was reviewing just other feedback that was left about your practice. And that's one of the biggest things that got me to come in the door, and I'm so glad I'm here.
Wonderful.
And
wonderful.
I do videos, and I train people, and use video as a training tool, and I really want to have my best face forward for that world, and so I'm very excited.
Beautiful. Well, we're gonna get started today here. This journey, usually we start in the morning. It'll be about 5 to 6 hours. And any questions, concerns that you have on the process before we start, obviously feel free. We're here to help you on this path.
Yeah. Okay. Great. Absolutely.
Thank you, everybody. Stay tuned.
Thanks.